You wake up and your stomach is tied in a painful knot, or maybe there is an exhaustion so deep you can barely stand. You spend hours independently scrolling through medical forums, cross-referencing every ache, and watching your worry spiral into a constant, heavy dread. Eventually, the anxiety peaks. You seek professional help and endure a comprehensive battery of physical tests and scans. Then the doctor walks in and delivers a frustrating paradox. The structural tests are completely normal. They conclude it must all be in your head. But the diagnostics are missing something crucial. The physical pain you feel is entirely real, genuinely felt, and incredibly disruptive. Living in that agonizing gray area, where your physical reality contradicts the medical scans, is defined clinically as somatic symptom disorder. The first thing clinical experts emphasize about this condition is that the symptoms are never faked. The physical distress is a measurable, genuine phenomenon. To see exactly how this works, take a look at this three-part diagram mapping out the anxiety symptom cycle. It begins here at the first node with a minor physical sensation or a baseline pain trigger. That trigger sends a signal to the second node, representing the mind's response, a massive influx of disproportionate worry, time, and energy fixated on the health concern. All that intense psychological distress activates the third node, triggering a literal biological stress response in your body. That stress reaction actively lowers your body's pain threshold, completing the loop and severely amplifying the original physical sensation. The mind isn't inventing the pain out of thin air. It is operating as a mechanical engine that intensifies the physical signals. To turn the engine off, you have to treat the mind. We can't always magically erase a baseline physical sensation, but the severe distress layered on top of it is highly treatable. The clinical tool specifically built for this job is evidence-based cognitive behavioral therapy, or CBT. Watch how this works on the diagram. CBT acts as a structural circuit breaker, driving a wedge into the loop to neutralize the intense worry before it ever triggers the body's stress response. Quieting that cycle removes the psychological amplifier. The physical symptoms are allowed to fade back to a manageable baseline, dramatically improving your ability to get through the day. Psychological therapy is an essential, primary medical intervention for somatic symptom disorder, not a final resort. Managing this condition requires a collaborative approach, treating the mind in direct partnership with steady, consistent medical care. You do not have to abandon your primary care physicians or specialists. Instead, a licensed clinician steps in to work alongside your traditional medical team. Because if you are dealing with these complex symptoms, you deserve a team that fully believes you and actively helps you. Coping and Healing Counseling, or CHC, is equipped to serve as the dedicated mental health half of that integrated care plan. Securing a specialized, validating support system is how you cross the bridge from living with a dismissive diagnosis to actually achieving healing. This map illustrates CHC's coverage area, delivering entirely HIPAA-compliant telehealth to all 159 Georgia counties to eliminate the logistical barriers of getting to an office. They maintain a diverse, culturally competent team of over 15 licensed therapists, including LCSWs, LPCs, and LMFTs, who specialize in anxiety, trauma, and stress. This comparative chart breaks down the financial accessibility. Medicaid patients have a $0 copay, while sessions under major insurances like Aetna, Cigna, Blue Cross, United, and Humana run from just $10 to $40. You can take action to start individual, couples, or family therapy today by visiting chctherapy.com or calling 404-832-0102. Breaking the symptom anxiety loop is possible. You can finally end the isolation of unexplained physical suffering.